I want to show you today how you can find out what your cardiovascular disease risk is. So I'm specifically talking about heart attack and stroke. And at Julian Healthcare, I often order this testing, which is done by blood, to help people determine if there's anything in their life that they need to change so that they can age in a healthy fashion. So I do a test that sends the patient a booklet like this. It's very specific to the patient and it tells them all about their cardiovascular health. So there's really 4 parts when you're looking at cardiovascular health to determine what your true risk is. And the first part is about the lipids, and lipids are fats. So there's different kinds of fats that we have in our body. Some of them are good, some of them are not so helpful. So this test helps to figure out which ones can be harmful for you and which ones you may need more of. The next part of figuring out cardiovascular risk factors is inflammation. So that's what I've been talking about on my blog posts and Facebook and Instagram this month. Any kind of inflammation, whether it's in your teeth or it's in a joint or it's in your gut somewhere, also affects the blood vessels that you have. And so I'm talking about inflammation of the lining of your arteries. And so when inflammation starts in those arteries, that's when white blood cells go to the area to try to fix things, and that's when you can start developing blood clots and formations that lead to narrowing of the arteries, and then your consequences of that are heart attacks and strokes. Another thing that plays into cardiovascular risk factor is metabolic factors. So by that I mean, what does your blood sugar look like? What does your insulin level look like? If it's elevated, that's causing inflammation. And we want to catch that really early. It's estimated that people who get diagnosed with diabetes have it for about 8 years before they actually get the diagnosis. And that is a lot of years of damage to the inside lining of blood vessels. And then the last piece of the puzzle that we look at for this particular test is genetics. So some people have genetics that predispose them to cardiovascular events. Maybe mom or dad had a heart attack at an early age, or they have a history of blood clots or strokes. So the genetic testing that we do with this test picks up those particular things. And no, maybe you can't change your genetics, but there are some things, quite a few things actually, that you can do so that you don't have to go down that same path that your parents did, perhaps. So we're going to look back here at the test and see what exactly it looks like when it comes back. It's really fun. Patients love it. It's colorful. So this is what it looks like. Green is great, yellow is caution, red is, oops, we really need to do something here. And so this particular test is just showing us cholesterol, LDL cholesterol, HDL cholesterol. So the top of this box is pretty much what you have gotten before from a traditional provider. And this tells us how many particles of particular cholesterol you have. So how many marbles of cholesterol do you have, kind of thing. This box down here tells more about what those marbles look like. Are they the hard, sticky, small kind that like to stick to the inside of arteries and cause blood clots, i.e. leading to heart attacks and strokes? Or are they the bigger, fluffier kind that's not going to cause a problem? This test tells me about that. One of the most important things that I get out of this test are inflammation markers. So there's 4 different markers that we typically get that tells us what is your inflammation currently in your body. And again, there's many things that we can do to get rid of that inflammation and decrease cardiovascular risk factors. Another thing that's very helpful on this test is a fatty acid profile. And again, this just tells me what kind of fats you're getting in your diet. So is it the trans fats that come in processed food that's not good for you, that's very oxidizing to arteries? Is it the good fats like EPA and DHA, which are in omega-3 fish oils? And we just look at that, we try to change dietary things, possibly add supplements that can then change patterns for the inflammation markers and can raise your HDL, which is the one that you want to be higher to help protect you from a cardiac risk. So with this little test, a simple blood test, we can get lots of information, and then I sit down with the patient and I put together a plan, and they can tell me Does it fit in their life? Is it something that they want to do? The patient to me is always the captain of the ship. I'm an educator. I'm going to be your best cheerleader. And I just help you to figure out how you can meet your healthcare goals. So if you'd like to learn more, please get on our website, julianhealthcare.com, or give us a call. Have a great day.